Dr. Han, Madam Shailaja, Chandra, Dr. Kataria, Dr. Khan, Dr. Murli, all the respected dignitaries in the dais and in this venue. Actually, I'm a bit tense because I'm, whenever I'm in front of Dr. Trahan, I have this particular syndrome. I don't know, I call it Dr. Trahan syndrome, but I have this problem. But anyway, I'll try to do my best.
Now you destroy my image also.
Okay. Basically, you all are very well aware of why we are doing this integrative medicine. So, yeah, very clear why Medanta has this approach also. Dr. Trahan had very well explained about it. As well, Dr. Kataria and Dr. Khan had given you some example of how we are working over there. But what I would like to show here is, or rather like to speak over here is, few ideas which I think had been the basis upon which why Medanta could be slightly different from other centers which were trying to do integrative medicine. And these were 5 of them. Basically, one was, I would first of all name them. It is belief. The second one was co-location. The third one was attitude. The fourth one was freedom. And the fifth one was knowledge. So, like when I say belief, there are 2 kinds of belief which I want to mention here. One is a belief which amounts to conviction based on knowledge and supported by intuition, as Dr. Trahan has, He actually believed about the success of an integrative medicine, or he still believes. From the very day I had met him in 2005, end of 2005, he had been telling me, you have to help, this combination of medicine should help 4 billion people. And he has, from that very day when I had met him, had been every time whenever I meet him. Today afternoon also he told me, what have you done? You have been, just, saying that you are sending massages and all those things. So what really have you done? This is the question he asked me. Even though I think that I had been doing something, but he doesn't think. He thinks that there is a lot of things to go and there is a lot of things hidden within this ocean, and he pushes. So that kind of a belief, that kind of a conviction actually made the Medanta, the Medicity. Basically, that was a dream which he called me into, and that is, I had joined him even before the whole hospital has come up. Then the next one is the kind of belief which comes from case-based or evidence-based kind of support which I give. For example, Dr. Kataria and Dr. Khan, they had an open mind, and there was a readiness to accept when an evidence was given to them, and then a supportive kind of a role they played in trying to understand and go ahead with us and try to change their belief, or rather, if they don't have a belief, create a belief. They were ready to support you by creating a belief. So believing that this was possible was one of the most important thing, and I was fortunate enough to be in working under somebody who was a leader and who was ready to believe and was convinced and was ready to take us all forward. The second one was co-location, and many other organizations have done that, co-locating to Ayurveda and modern medical wings together. The difference in Medanta is that we are co-located in the same outpatient department. I sit in the same, exactly opposite where Dr. Khan sits, and the Panchakarma rooms are placed exactly in the same space where you have the sleep medicine wall, the high-tech sleep medicine, equipments are kept, or maybe let us say in the GI tract room you have the endoscopy unit. It is exactly the same space. It is not in a relegated place where in the go down or in the really it happens. I have seen it happening, but I am thankful to Dr. Trahan that he had the vision to say that no, you are not going out, you are staying in. And I had been made to stay in the OPD, the main OPD, and I had been made to work within the main programs of Medanta by co-locating me within that particular area. The third one was attitude. Like attitude is open-mindedness. Of course, I told you about it. Like Dr. Khan and Dr. Kataria are prime examples for that. To be open, to understand, to accept that if there is something possible, then of course it is possible. It is you don't have to look at whether there are chemical reactions happening. But if a patient is feeling better, a patient is feeling better. That's it. And accepting challenges. When I go and tell Dr. Khan that I could, or maybe Dr. Kataria, that I could probably give a medicine without harming a patient in the sense of reducing the activity of radiation, she should be challenging enough. She should be able to, she should have the attitude to be challenging enough to take that as a opportunity, and maybe try and see whether it is working. If it is working, then it is good. If it is not working, that fine line of decision has to be taken by her. I can only offer her what I have. So this is an accepting challenges, the attitude. And then there was an inquisitiveness, like whenever you go, to ask whether you have something for that. Today, there was idiopathic thrombocytopenia patient. We are working with triple IM and thrombocytopenia drugs also. So there was this call from the internal medicine department. This patient has gone down in platelet count up to 4,000, 2,000. Do you have something to do? The patient had been right now in the hospital for the past 20 days and he has been advised for splenectomy. We will give you 2 days. Can you increase the platelet count? So this was the question. This is an inquisitive mind, coming from the internal medicine department, asking whether you have something. Can you help the patient? This is something which was really, is the basis of how Medanta is, doing what we are doing. And seeking new knowledge, of course, is part of what we had just said. And accepting new knowledge, that is also the attitude. The next one is freedom. The degree of freedom. Like, to the freedom in India, it is quite easy to function as an Ayurvedic doctor within an allopathic setup, because regulatorily we are allowed to function within the constitution, the place, the geographical location of India. We are allowed to function as an Ayurvedic doctor because we are given the certificate, and that is exactly what we do. I never prescribe one single modern medical drug, and my colleagues do not prescribe any of the Ayurvedic drug. Actually, it is a kind of freedom which has been, we utilize each other. If there is a requirement that there is a requirement for an Ayurvedic drug to be prescribed, if there is a requirement for a betadine to be written, I don't write it. I request my colleague to see whether can you write, this patient requires betadine, he has to do a sitz bath. Can you give him, can you write the betadine lotion for him? This is how we approach that particular thing. But the freedom to function, that is more important. Like, there is no curb, in Medanta, I am happy to say that I had been fortunate enough to be accepted as any other medical doctor in Medanta. Like, every single resource available to any other doctor is available to me. It has never been denied. No questions asked. Why you want this had never been asked. Why you are not asking is the main question that is being asked. Really. Why you are not asking is the main question that is being asked. So that kind of a freedom was another thing which could have made us do this. And finally, knowledge. Knowledge of whether to do an integration or whether not to do an integration is also very important. Like, whether not to do will only come with true knowledge. Whether we should apply a particular treatment to a particular patient at a particular case and a situation will come only through really experience. And I should say that when I started working in Medanta, I didn't have that experience to say that, okay, whether it should be done in combination with an allopathic doctor. I am sure that many of us might not be having that. But our way of collecting data, we had created tools in which we could collect data very easily on OPD levels, on Panchkarma, on every patient we do a thorough patient follow-up. We have phone numbers of every single patient who comes to us. We call them back and ask them how you are. We have different ways of doing it, but then we call them back and ask them whether you are okay, are you fine, are you happy, how much from 0 to 10 level are you happy right now. This is what we ask them. So we get these numbers also. And of processes followed for successful integration with well-defined clinical pathways. This is what we made, and we didn't have the knowledge of that. We knew for example, I knew how to maybe combine Ayurveda or yoga in my own patients directly, but I didn't know how to combine it together with allopathy. I didn't have the knowledge, so I had to work and create along with my colleagues that particular pathways, and we have 73 of them created. We have well-structured pathways which are of course amenable to according to the patient situation, but the basic structure is there. We had already created that. And then we also did not know about the probable outcome of integration. So this also had to be an experienced thing. And we also didn't know about the comparative benefits, whether a patient starting with integrative medicine would be benefiting more than a patient simply going along with Ayurveda only or only with allopathy. We didn't know that. So we actually had developed that knowledge. And on comparative demerits also, whether by doing Vasti in a particular manner, can you cause a kind of an infection to a patient, or can you cause a colon reaction which can make the patient to be admitted? these are things which we had observed and written down. And so, or maybe a particular drug, can it cause a kind of unknown reaction? We have found, or maybe can yoga create side effects? We have seen side effects of yoga. Actually, we never knew that there was a side effect for yoga, but we could see side effects of yoga. Not even meditation. We could find out the side effects of even meditation. So we have documented that. So this knowledge is the final ingredient which is most important in creating integrative medicine. And hurdles for integrative medicine is again lack of knowledge, experience and expertise, mindset of practitioner. It is a professional distrust. Like as Madam Shailaja Chandra had said, there could have been professional distrust, but I think, or maybe because Dr. Trahan is there and his shadow is there, maybe because of that, or maybe I don't know why. But if there had been colleagues who had been distrustful in the beginning, we were able to convert them. Actually, convert them. That is the truth. We had been able to, people who had been against using Ayurveda in their patients had been very consistently sending me patients, their own patients, who would have gone for surgery otherwise. So this is the situation we had been able to do. And mindset of society, it's a conditioned disbelief of Ayurveda, and I'm sure that it's a conditioned disbelief. It is because of the social setup and the kind of education which is being imparted to us. We are bound to disbelieve what is said in the alternative medicine. So I think that needs to be changed. Regulations, of course, are a little bit of a hurdle in India, and fundamental differences among integrating medical sciences, like Ayurveda thinks about Vata, Pitta and Kapha, and modern medicine might definitely think about chemistry, physics and biology. So these are the hurdles of integrative medicine, and thank you very much for this time.